This video is for general information only and does not replace advice from your own GP, diabetes team, or pharmacist. If you have questions about your treatment, always speak to a healthcare professional. Who qualifies to receive Mounjaro on the NHS or privately? Let's break down exactly what you need to know about accessing it in the UK. If you have type 2 diabetes and your blood sugar isn't well controlled, Mounjaro is a treatment your doctor might consider. But there's a clear process involved, and understanding it can help you have a much more informed conversation with your healthcare team. Mounjaro, the brand name for tirzepatide, is a prescription medicine licensed in the UK, specifically for type 2 diabetes in adults. It works by mimicking two naturally occurring hormones, GIP and GLP-1, which help regulate blood sugar levels, support insulin release when glucose is elevated, and reduce the release of glucagon. It also slows down how quickly food leaves the stomach, which can reduce appetite and promote a feeling of fullness. This is why it can support weight loss alongside blood sugar control, though it's prescribed for type 2 diabetes management, not as a standalone weight loss treatment. It's given as a once-weekly injection using a pre-filled pen, with the dose gradually increased over time as tolerated. Your doctor will guide you on your prescribed dose. This isn't something to self-manage. So how do you actually access it? There are two routes in the UK, NHS or private prescription. Either way, you can't simply request it. You need to meet specific clinical criteria and undergo a proper medical assessment first. On the NHS, eligibility is based on NICE guidance. You generally need to have type 2 diabetes with inadequate glycemic control despite already being on treatment. It's not a first-line option. It's typically considered when medicines like metformin haven't provided sufficient blood sugar control on their own. It's also worth knowing that access can vary depending on your local NHS area, as integrated care boards or ICBs make their own formulary decisions, so availability may differ by region. And it's not just about getting started. Under NHS guidance, ongoing treatment usually depends on demonstrating clinical benefit at around 6 months. Your diabetes team will confirm the specific criteria they use in your situation. For a private prescription, you still need a comprehensive assessment from a UK registered prescriber. It's not a shortcut. The clinical standards are the same, with ongoing monitoring required every 3 to 6 months. So what does that pre-treatment assessment involve? Your healthcare professional will check your HbA1c levels, assess your kidney function, review your full medical history, and rule out any contraindications. And there are some important ones. Mounjaro must not be used in people with type 1 diabetes or in anyone experiencing diabetic ketoacidosis. It should not be taken alongside a class of diabetes medicines called DPP-4 inhibitors. It's also not recommended during pregnancy or breastfeeding unless a clinician has determined the benefit clearly outweighs any risk. So if you're of childbearing age, effective contraception is important while taking tirzepatide. If you're already on insulin or sulfonylureas, your doctor will need to review those doses carefully, as combining them with Mounjaro can increase the risk of low blood sugar. If you're considering Mounjaro, here's what to bring to your next appointment. Ask whether your current HbA1c and treatment history make you a potential candidate. Ask about the assessment process, what tests you'd need, and what monitoring would look like going forward. And be open about your full medication list so your doctor can check for any interactions. When should you seek help urgently? If you experience symptoms of low blood sugar, such as shakiness, sweating, confusion, or feeling faint, contact a healthcare professional. If you develop severe abdominal pain, persistent vomiting, or any signs of an allergic reaction, seek medical attention promptly. In an emergency, call 999. For urgent non-emergency advice, call NHS 111 and never adjust your diabetes medication without guidance from your doctor. To recap, Mounjaro is a licensed treatment for type 2 diabetes in the UK. Accessing it, whether through the NHS or privately, requires a proper clinical assessment and meeting specific eligibility criteria. and ongoing monitoring is a key part of staying on it safely. If this video helped you understand the process a little better, drop a comment below. We'd love to hear your questions. Give this a like if you found it useful, and subscribe to Bolt Pharmacy for more medically reviewed health information.